Hi, my name is Zeb Pascual. I'm a registered nurse working with 24-hour home care, and we're here in Goodwill, Long Beach, and I'm going to go over tips on how to prevent falls. This is crucial for especially our population of patients where the fall risk is enormous. So these are the tips on how to make sure the environment is conducive to them not falling where they otherwise would have. So the first recommendation is actually regular exercise. Regular exercise helps increase leg strength for them to support themselves. It increases bone density strength, because in old age the risk for osteoporosis is even greater, and the number one indication for osteoporosis is weight-bearing exercise. So please refer to the other video as far as my suggestions for taking care of yourself. That also applies to the patients. The next thing I recommend is putting these things called guardrails. There are guardrails. You can put them anywhere in the house, put them near the bathroom, put them in the hallways, put them in the living room, the kitchen, near the bed, so that it's strong enough to support themselves and it keeps them upright. That's the purpose of the guardrails. There's also such a thing as non-slip floors and non-slip shoes. You want to make sure that the floors are not waxed smooth necessarily. You want as little slick as possible as far as the traction between shoe and floor. So you want the shoes to have grip. You want the floors possibly to have some kind of traction so that there's no slipping. As far as the actual walkways, you want to ensure that the walkways are clear of any obstacles. That's huge, just because sometimes the patients can't see and sometimes they can't even reach. So you want to make sure that you have cleared all of this. As you can see, there's obstacles here. I'm just going to go ahead and remove them and put them in a place where they will not be, at the very least, not be on the floor. So that will give the patient a long, smooth walkway that they don't have to worry about tripping over anything. If they go to stairs and they need help, absolutely they can use the guardrails and the stairs to help themselves up. That's what they're there for. Choosing chairs, you want to make sure that they choose chairs that have supports and arms, so that way they can help themselves sit down and help themselves stand up with the use of their arms in addition to their legs without help. And finally, if they need help walking, absolutely they should use assistance devices like canes, walkers, maybe even a crutch or two. And those are some of the tips on how to prevent falls in our patients. For more information, please visit www.24hrcares.com.